The Jogan Experience.
People really believe that Muskie was eating Ibogaine. I never said he was. I said there was a rumor in Milwaukee that he was, which was true, and I started the rumor in Milwaukee.
I finally said, well, you made it all up.
I couldn't believe that people really believed that Muskie was eating Ibogaine.
Yeah, it's just repeating itself over and over.
Oh,
But
my God.
yeah, it's in the Gonzo, the documentary.
That's
it
hilarious.
goes into it in depth. He just decided that the guy was a big phony, and so he made up this story about the guy being addicted to Ibogaine, of all drugs, which is kind of crazy. And so that's how the public got introduced to Ibogaine.
Now, Schedule 1 says that there is no medical purpose for this compound, whatever it might be,
Yeah.
and that it's addictive. And Ibogaine is neither of those. I
Right.
mean, clearly evidence, as a matter of fact, if there was a definition of a compound that was not Schedule 1, Ibogaine would be the top of the list, most likely.
Yes, but yet it's Schedule 1.
Yeah, yeah.
Yeah.
And I think for the purpose of educating the public, we go back and understand the early 70s, what Nixon was using these compounds for a political purpose, and he gathered them all up, swept them all up, and put everything under Schedule 1 so he could go after his political enemies,
Yes.
using these compounds as the vehicle to do that.
Yeah, and for the last 50-plus years, people have been imprisoned by that.
Yeah.
And that's a giant problem particularly for veterans, which is, I think, the most important use of these things, because it's going to open eyes to people that would never consider the concept of plant medicine or psychedelics. They would never consider it. But most people are so compassionate about the needs of veterans, the demands that they face, and the trials that they face when they return, the mental struggles, the amount of suicides, the amount of addictions. It's overwhelming, and they don't get any support. Yeah. And people are kind of desperate, and that's what opens up the door to people considering things like yourself, considering things that would not have normally entered into your landscape.
Yeah. You look at you look at the history of how I got there, and I grew up on a dryland cotton farm, about as conservative a part of the world as you could be. I went to school at Texas A&M. I wanted to be a pilot in the United States Air Force. I mean, drugs were absolutely not anything that I wanted to have anything to do with, because at that particular point in time, in the early 70s and in the mid 70s, we got drug tested on a monthly basis. No notice drug testing. You go pee in a bottle and they test you. And if there was one time that you didn't pass that drug test, you were done. And so the fear factor of drugs was driven into us. You go forward with the political messaging through those years, your brain on drugs, just say no to drugs. I mean, and on the one hand, that's a good message. On the other hand, when they're used just for political purposes, and you put compounds on Schedule 1, like Ibogaine, and it can't even be used for clinical trials. It can't be medically used to see, is there some good that can come out of this? And the fascinating thing for me, Joe, is that Mexico, this is a compound that can be used. Canada, I think Australia, France. I mean, there's a host of countries around the world that allow for Ibogaine to be used for, clinical trials and for medical purposes. Yet we're sitting here with 20-plus veterans a day killing themselves. Yet we have a compound that clearly the data shows that this compound, appropriately used and appropriately overseen, can absolutely change lives and save lives. And for me to be able to know that, and then still see government say, no, we're not interested, is really frustrating. And it's why I'm so excited about, Bobby Kennedy, Jay Bhattacharya, Dr. Oz, Nolan Williams, individuals who may come into this administration at some very high levels that are supportive of plant medicine. So I think we've got this great opportunity. We've been given this gift, and I hope you got members of Congress that are supportive of this on both sides of the aisle. This isn't a partisan issue of any sense of the imagination. So I'm really excited about the potential of being able to get clinical trials done, move this off of Schedule 1 into worst case scenario Schedule 2, even Schedule 3, so that we get the broad amount of trials done so that people who have questions about it, those can be answered and they can see the data. We'll talk about this clinical trial out of Stanford that is just stunning results.
Well, let's talk about that. Like, when was that performed?
Bryan, you want to hit that one, or you want me to take it?
I don't mind to take it. In 2018.
Bryan, pull that microphone up to your face a little bit. There you go.
How's that?
Perfect.
All right. In 2018, individuals by the name of Amber and Marcus Capone founded an organization called VETS, Veterans Exploring Treatment Solutions. Marcus Capone had been a special operator, and he had done multiple tours in both Afghanistan and Iraq. When he came home, finally from war, Amber described an individual who bore no resemblance to the man that she married. He came home as a severely traumatized individual and was met by a system which could not in any way effectively address the nature of his trauma. Recognizing that his life was at stake, as well as the future of her family, she became desperate and went online and discovered the existence of a compound called Ibogaine. She made arrangements for Marcus to receive treatment from an individual by the name of Martine Polanco, who operated a clinical operation called Mission Within. Amber, as a last shot at saving her family, sent him to Mexico to receive Ibogaine treatment. She said when he returned, he came back as the man she remembered marrying before he ever went to war. As they learned about other friends of theirs who were coming back home with similar circumstances on the verge of familial dissolution, with Marcus and his friends at the verge of suicide, they began, just as a friend group, to put money together to send their close circle of individuals down to receive this treatment. They came together to form VETS, and since 2018, over 1,000 veterans have traveled to the Ambio Clinic south of Tijuana to receive Ibogaine treatment for symptoms of traumatic brain injury and post-traumatic stress disorder. Because of the miraculous outcomes which were endorsed by the veterans who were receiving this treatment, a group of philanthropists funded a study out of Stanford University, which was led by Dr. Nolan Williams. And over the course of several years, a cohort of 30 veterans were evaluated before and after Ibogaine treatment. They were evaluated comprehensively through the administration of a battery of psychological tests to quantify the nature and duration of their symptoms. They underwent pre- and post-treatment MRI scans. These scans were compared against a database which had been compiled of hundreds of thousands of healthy adult brains covering the human lifespan. And through an algorithmic assessment, the question was, what was the physiological effect upon the human brain, if any? To explain these miraculous outcomes were veterans who had been on the verge of suicide, who had been paralyzed by symptomatology associated with profound anxiety, profound depression. In many cases, veterans who were prescribed an array of habituating pharmacology which ineffectively addressed their symptomatology were not just back to what they could remember being before they experienced their trauma, but had been liberated from that pharmacology. The results of that study are nothing short of miraculous when it comes to the way in which Ibogaine has been revealed to have significant neuroregenerative properties that impact the human brain, with profound implications for conditions for which there are no current effective treatments. Specifically, the white matter that covers the surface of our brains, which is the highway across which all of our thoughts and impulses travel, grew and thickened in size across the entire surface of each of these veterans' brains. The centers of the brain responsible for emotional regulation and executive functioning grew in size. The average reversal of brain age among this cohort of 30 veterans was 1.5 years, with the top 5 among that cohort seeing a reversal of brain age of almost 5 years. Right now, there are individuals who live offshore from the United States who are using Ibogaine to effectively treat symptoms associated with multiple sclerosis, Lyme disease, and Parkinson's disease. Just about 2 weeks ago, Governor Perry and I had the privilege of spending some time with a researcher who is based out of the University of Zurich in Switzerland. This researcher has developed a protocol for the treatment of Parkinson's symptoms with Ibogaine. We had the privilege of visiting with one of his patients who wishes to remain anonymous, as well as a family member of this patient. We were shown a video whereby this individual had developed Parkinson's disease at the age of 41. It had advanced so aggressively that by age 51, this gentleman was completely bedfast. As a last resort, he underwent an invasive intracranial surgical procedure called deep brain stimulation, where they drilled holes through his skull and implanted electrodes which were designed to stimulate the production of what is called glioneurotropic growth factor, which essentially stimulates the dopamine receptors to produce dopamine, the absence of which is implicated in the development of Parkinson's disease. And while this gentleman was no longer bedfast, he was not able to volitionally control his bodily movements. The video that we saw demonstrated his attempts to stand and walk, and the ability to walk was non-existent. After he had undergone the deep brain stimulation, he signed up for euthanasia services in the country in which he lives because it is legal, and he was at the end of his rope. He underwent a 4-week course of upward titration with low-dose Ibogaine that did not produce a psychoactive experience. And at the end of those 4 weeks, that gentleman was able to stand, walk, and function as a normal human being. The outcome is nothing short of miraculous.
His mother said that he rode his bike every day now. I mean, I'm telling you, Joe, this is the most stunning. I mean, it's a short video. I get it. It's anecdotal. But for my purposes, it was just backing up what we have seen and what we've learned about how Ibogaine. Now, the treatments down in Mexico are flood doses. This was a microdosing that they did over there. But again, it gets to my point of this is exactly why we, as the United States, and with our medical capacity in this country, need to be doing this type of clinical trials so that we find out, is this really what we think it is? And if it is, this needs to be widespread treatment for MS, for Parkinson's, for addictions, for PTSD, for traumatic brain injury. I mean, I think we're on the cusp of some extraordinary medical breakthroughs because of this compound, Ibogaine.
Dr. Williams has said, and I agree, that Ibogaine is the most sophisticated medication on the planet. The results of that Stanford study were published in a top 5 medical research journal called Nature Medicine on January 5th, 2024. An organization called the Brain and Behavioral Research Foundation named that study as its number 2 study in terms of neuropharmacology in the world for the year 2024. I have become convinced that any system which maintains Ibogaine's criminality is in fact criminal and needs to be tore apart brick by brick.